last panelist today is Liya Kebede, and Leah is a supermodel. She comes from Ethiopia, but she, in March of 2005, was appointed as the WHO Goodwill Ambassador for Maternal, Newborn, and Child Health. In 2006, she founded her own foundation with a mission to reduce maternal, newborn, and child mortality and to improve the health and well-being of mothers and children around the world. So I guess a couple of questions for you. From your perspective, as a world-famous supermodel, why did you choose to focus on maternal, newborn, and child health? And what role do you think that high-profile individuals like yourself can play in highlighting the needs of the most vulnerable and helping to accelerate results?
Thank you. You know, I got involved because, really, for me, the reality that every minute a woman dies due to pregnancy and childbirth-related complications is just unacceptable. And especially when we know that most of these deaths are preventable. I grew up in Ethiopia, and growing up in Ethiopia, I heard about women dying bearing childbirth all the time. It was something that happened. It was part of everyday life. But now I know it doesn't have to be that way. The geographic location of a woman should not determine whether she lives or dies while bringing life into this world. I gave birth to my children in America, but I realized that with a twist of fate, it could have been my life or the lives of my children that could have been at stake. We have the power to save the lives of women and children, and we should. You know, for addressing your second question, yes, of course, high-profile individuals can have huge impact on the progress for maternal health. And that's because most people don't really know that this issue, first of all, exists. Most people don't know that the most common reason for women to die in developing countries is pregnancy and childbirth-related complications. They don't know that the MDG5, the maternal health, is the one goal that is currently lagging behind and one that probably won't achieve that likely won't achieve its goal. I think to give an idea of what it means really to be delivering in a clinic or in a hospital in a developing country, I have a story to tell. And this story is about this woman I met in Ethiopia when I was visiting, when I had started working with the WHO. And this woman was a woman that was being documented. Her pregnancy was being documented by the WHO. She was a 17-year-old girl. She lived at home with her mom, and the father of her child had left because he just couldn't handle the responsibilities. And she, you know, told me when she was pregnant, she had to walk about an hour to go to the nearest clinic. There were no blood tests or no birthing classes there. And when she was ready to deliver, she went to the hospital and was asked to pay for the gloves that were going to be used for her, the sheet, the syringe, the water, all of it. She had to pay for that, and she didn't have any money. And so if you didn't have any money, you are sent back home. And the man, the photographer from the WHO that was documenting this, who was luckily standing there, realized that he just couldn't just sit around and do nothing. So he got into his pockets and paid for a safe delivery for this woman. This woman delivered in a hospital that did not have any running water. So this is the health systems that we're talking about that need strengthening. I have here sort of a birthing kit. This is what a birthing kit looks like in those areas. It's very simple. It has a piece of soap, gloves, I think, some gauze material, sheets maybe, and a cord. This actually costs $10. So women who come to hospital to deliver in clinics are expected to have $10 to pay for this, and this is supposed to save their lives. There's also an issue on what happens to women who don't have $10 to pay for this. When I was in Senegal, I heard about another version of a birth kit, which is, if you don't have $10 to pay for this, you're asked to bring 3 pieces of cloth. One is to lay under the mother while she's delivering. The other one is to clean the mother up afterwards. And the third one is to bundle the baby in. 3 pieces of cloth to deliver a baby. So what happens if this woman needs, God forbid, IV fluids? Does that mean that since she can't pay for a syringe, she won't get one? Does it mean that a doctor won't use gloves because she hasn't paid for it? I mean, it's ridiculous to think that these are the health systems that we're facing. So yes, so international donor communities absolutely need to do something about strengthening health systems, because this is the health systems that we're talking about, just to give you an idea. At the same time, there's also things that can be done, of course, because strengthening health systems is going to be expensive. We know that. It's going to take time, but we still have to do it. But while we're doing this, there are other things that the local governments and the local NGOs can also do. Because a woman dies not just because she can't have access to this, of course it is, but also things like you guys mentioned. Early marriage makes a big difference. Women not having access to birth control, or not having information or access to reproductive health tools. Those all matter, and these are more achievable and less costly efforts that can be done that will make a difference in a girl's life. Because right now we have, what, 1 in 7 girls in developing countries marries before the age of 15. That means that this girl is increasing her chance of obstructed labor, which is one of the leading causes of maternal death. Obstructed labor happens because, why? The body of the girl is not fully developed. Because she's too young. That's all. It also means that she's likely to have more children than she can afford to or want to. And thus she risks her life with each new pregnancy. Education is another important aspect of this. If she could start her family a bit later, she will stay in school longer, which means that she can better support her children once they are born. We have the power to save the lives of mothers and children, and we should. So if you're a donor nation, please maintain development aid and prioritize some of your health funding for mothers. If you're a developing nation, prioritize this within your own health projects and fund maternal and child health. We just have to do something. We just cannot ignore this anymore.